Assalamu alaikum everybody. This is a brief video regarding the method of connecting or inducting a CRRT machine and starting CRRT session. We will start by the equipment needed for the CRRT machine. First of all, you need to know the type of the machine, because here in the hospital we have two types. This is the old machine. There is another machine in the ICU, because every machine has its own set, and according to the type of the machine you will need to get the proper set for that machine. So these are the contents of the CRRT set, starting by the filter, dialysate and substitute bags, and another kit for the arterial, venous and waist connections. Simply 4 pieces, and this is not included in the kit, but we'll bring it. This is a filtered bag for the waste collection. We will also need 4 bags of this multi-big solution. This is the CRRT solution. There are also types of this. As far as I know, we have 2 types. This potassium plus 2, and there is a potassium free 0 millimole potassium for the patients who are hyperkalemic and so on. This is according to the physician's instructions to use this regular bag or the potassium free bag. So take care when you pick up these bags. Is it 2 or 0 millimole? We need to make sure that the machine is connected to electricity, the machine is clean. Also very important, I will try to not to take the patient's face for the privacy of the patient, but you need to check the lumen, whether it's double lumen or dialysis or permacath. You need to make sure that it's patent before everything. Aspirate, because there should be 1.5 ml saline with heparin in both lumens. So aspirate, then discard the heparin. Make sure that both lumens are patent for the arterial and venous connections before you start, because later you might face a problem that is high arterial or venous pressure, because there is a problem in the patency of the lumens. So basically these are the needed equipment. Also we'll need normal saline for the priming. Around 3 normal saline bottles will be used for the priming of this type of the CRRT machine. Okay, so be ready with 3 normal saline bottles. First of all, you need to check the orders, the physician's order, and here also we ask about the approval. So check the order, the details of the order. Write it down, because it's on the computer. You need it during the induction of the CRRT. The details, how many hours, the ultrafiltration, the pump speed, the dialysate, the substitute, all these parameters you need to know. So while connecting, you will enter these parameters. You have everything ready beside your patient, so turn on the machine. You will find processor test in progress. This is the test for the machine to be ready. Don't put anything on the machine, especially these 4 bags, because these are 2 scales. The scales should be empty. There is no load on these scales. Don't try to put like solution bottles or collection bottles. The filtrate bag filter, don't put anything. So these are the starting conditions. As we mentioned, no solution bags on the scale. This is the scale. No filtrate bag down here where you put the filtrate bag. These 4 no tubing system inserted, no pressure transducer connected, no line in optical detector. This is the optical detector. No line in blood leak detector. Okay, all these conditions are fulfilled. Then press OK. This is the OK button. The buttons we have is the power button, start and reset button, stop button. This is the alarm silence button, and then we have the escape button. We have 4 sensors. That is the red, white, blue, and yellow. We also have 4 pumps. That is red for arterial, yellow for the waist, white and green for the dialysate and substitute. Same 2 colors, green and white, you will find here for the back, and you will find here also for the citrate and calcium, but we are not usually using this. This is where you will connect this tubing, same dialysate and substitute. And also on the back of the scale you will find the same 2 colors, that is 1 green and 2 for white. This means that there are color codes in the all connections of the machine. This is to help you not to be confused. So starting conditions fulfilled. Okay, confirm. Again, test is in progress. It will ask you, is it the same patient you are using for this is the previous patient, or you will start a new patient. So select new treatment if new patient. If previous patient with same previous parameters, use continue previous treatment. We will select a new patient, and here the mode is CVV HDF. CVV HDF. Now it's in the preparation phase. This is the indicator, it's reaching now 43%. Now we should be waiting. This is the testing for audio alarms. Okay. These are the starting conditions: cartridge, standard substitute, dialysate. These are the 4 bags I mentioned. Conditions fulfilled. I will scroll using this OK button. So conditions fulfilled, and then I will press. These are the preparation instructions. These are the color codes: red color for the arterial, yellow for the waist, blue for the venous, scroll, then it will give you the dialysate and substitute colors. These are the white and the green colors, and this is the heparin. You check also during checking the doctor's order, is there heparin for this patient to be started during the CRRT. Good thing that this patient will take heparin also, so we'll explain this. So keep scrolling left and right until you completely finished same steps, same like as you see in the screen. We'll do it anyway. Now we will start the connections. This is the filtered bag, as we mentioned. Filtered bag will be held down. Okay. This is the filter. Until the cover. We usually don't use this part. Keep it until you finish anyway. And this is the filter. We will convert the filter, but this is later, in a later step. So we'll attach the filter here. And we will put the 4 bags. These 4 bags has 2 parts inside. So we should mix these 2 parts together. This is the small part, and there is a separator in between. So it should be mixed together. And we will put 2 bags on each scale. These are scales, and it has sensors. Again, we will mix the 2 parts of the bag. Two bags on the dialysate scale, another 2 bags in the substitute scale. Okay, can you come? When you look at the back of the machine, you will find the 2 colors. That is the white color and the green color, as we mentioned before. And this is how you exactly balance the 2 bags on both scales, because the sensor will weigh the weight of the scale, and if there is deviation, it will keep alarming that there is a balanced deviation between both the dialysate and substitute bags. Okay, so keep it ready until we will start connecting later. Okay, so we put the filtered bag in place, and the 4 dialysate and substitute bags. These are the 3 normal saline bottles. We mentioned that it will be used for priming. Keep it ready, hang it up, open it, because later this bottle will be finished maybe in 30 seconds or in 1 minute. So you need to be ready at that time to fastly connect and change the normal saline bottles. Okay. Now we reach the second and third parts of the kit, that is the substitute and dialysate. Here you basically follow the color codes. This is the white color that will be connected here inside this white bump, and the green color same for green bump. Okay, starting by the green color. This is the set. Don't let anything touch the floor for infection control purposes, not to contaminate the set. Okay, this is same for dialysate and substitute together. This will be in the filter. These two arrows explains the direction of the fluid, and these two connections will be at the back of the scale, at the green color of the back. So start by the pump, open the specified pump according to the color. Let these arrows to be at the outside part, then fit it inside. When it's inside, then keep pressing on the start button. The pump will keep rotating until it's totally fit inside. Then close it. Okay? You can take the guidance of the preparation instructions. For example, now I am starting by the green color. I will keep scrolling until I find the green color. This is where I put, this is where is the bump, that bump, and then using this line, I will follow the instructions. It tells me to fix it here. Here I find a green color, so I fix it. Then the balloon to be set inside. This chamber. Okay, then close. Then it goes up where I find here another green color. I am following the same color still. So I will fix here. Then it will come back to the filter. At the same place of that instructional photo, I will fix this green part, the end of this green connection in the filter. That is here. You see it here in the video, in the photo. So I will connect the green color. The other part of the cable or of the wire will come to the back. We are still following the green color. Can you show this green color? We are still following the green color. Okay? So uncover these connections and both to be firmly tied. Close these two valves, and if you please come closer, break this valve, just kink it, right and left. Now it's open. If you see this part is broken, it means that it's open. If you open this valve, this liquid will come in the wire. Same other part. Open this only after you close, you clamp here, because otherwise it might come down. These covers are not needed. Immediately, if you uncover something, discard it, so you will not be confused. Now we finished the green color. Scroll left and right to see the white color. same as the green. You will find two arrows here. This is the white pump, as you can see on the screen. Put inside, press on the start button, let the pump rotate until it's fixed. Cover, follow the same color. Here it's coming down. This is the white color, as you can see. So fit. Open the chamber. Put this balloon or container inside the chamber, totally inside, fit it, close the chamber, and this, the end of this part, to be here up. So we'll just keep it until we connect the other part here. Okay, this white end will be connected to the other part. Going back for the white color, I am fixing the connections now, so it will not be later confusing or mixed. I will clamp both, uncover, then it doesn't matter where is left, where is right, for both green and white. It will be all coming to the same line later. Then I will kink and break. Left one, right one. Same two. Still now the 4 tubes are clamped. Then the covers will be discarded. So inside the kit itself there are 4 small kits. One for the filter, one for the substitute, one for the dialysate, and the other main one is for the arterial and waist pumps. So I will start the final and the last one. I will scroll until I find it here on the screen. Even if you know, keep it on the screen, so it will guide you anytime if you are confused. Open it. This part will be used if you need to do care for the patient, for example, and for a while, let's say 10 minutes, you want to take the machine away from the patient if you need to do something urgent procedure, or you want to do care. At that time there will be blood inside the set. This blood, if you want to avoid clotting, this will be connecting the arterial and the venous lines, both. It will be both connected here, and the machine will be rotating slowly, so the blood will not be clotted. What I mean, don't discard this. Very important, this part. Keep it aside until you put again beside the patient. This step will be going inside the normal saline bottles. We need a wide needle because of the fast blood flow coming during the priming. Okay, anything you don't need, to the waist. So to be ready to attach this, open the cover, same like this. Open this cover also, because it will be fit, same size and same place. Very important here not to let anything touch the floor or touch unclean surface. Okay, rotate it up. This is how it looks. This is the red color. This is the yellow cover. Okay, what I used to do to make it easy and simple for me, this fluid collection bag, try to put it away from the scale. Anything touching the scale, even the flow of the air conditioner, will affect the scale here. This scale is very sensitive. So I put this back. I will keep this valve unlocked, open. Okay, and I will simply hold every ending in my hand so it will not touch anything, and I will let it pass through the cover. Fit this chamber. Fit this chamber inside and then look. Now I finished one part. Okay, this is the venous sensor we mentioned before. Fit it inside again. It's fit. Close it. Okay, now you have only remaining red and yellow. While these doors are open, press on the start button. It will rotate and let the wire to be inside the bump. Then I will close the covers. Not to be confused, all the time please follow the color codes. Okay, this to be attached in the filter here down. Okay, so down I will put. This is a white sensor. Where is the white color? Here. So I will attach. Here is the yellow color. Where is the yellow color? The waste line at the back of the filter. So I will attach. Remaining in my hands, the red sensor for the arterial pressure, also to be attached. We mentioned that we have 4 sensors. Now we have connected 2, remaining 2, arterial, waist, venous. This is the venous sensor to detect the pressure. Okay, and the TMB. These are the 4 sensors already attached. Remaining in my hand, the blue, that is the venous line. Here you will find a place where you can fit this blue wire. Okay, so again it's in place, not confusing, not crossing any other line. This ordering and following of the codes is very important for you later. So instantly when you look at the machine, you know if there is any mistake or is it correctly or not correctly attached. This is also a sensor for the waste. It will come here in the filtered bag. You should put it inside and then close it. remove these covers and then attach. So these two will be open, same like the venous wire, not same as the dialysate and substitute. The 4 valves will be kinky. I have here also blue color, and here you will find red and blue. If this machine at the right side of the patient, so you can fix the arterial and the venous tubings here. This will help the tubings to be fixed, so it will not fall left or right. Okay, if it at the right side of the patient, sorry, I was confused about the directions. First, if it's at the left side of the patient, so you can connect here as we mentioned. If it's at the right side of the patient, this is according to the lumen, the permicath or the double lumen. Where is it? Is it at the right side or at the left side? Now, it's right jugular. So, we are at the right side of the patient. There is no place in the machine to connect this red because it's closer to the patient. But still we have place for the blue tube, that is the venous. This is how you fix it, so it will not be touching any contaminated surface. We have now remaining, I will put this one here. I also have the option, or better, if I want to hang it up, I can hang it here. This is another place for the arterial and venous lines that you can put here kida, if you want to do anything else. Okay, here there are two types of the CRRT machine connections. According to the order, the physician will tell you this is a pre-dilutional or post-dilutional CRRT session. So if post, it will be connected as you can see now. This is the end part of the white color substitute will be connected here. As this is a post-dilutional CRRT session. Post-dilutional means what for you to understand? Pre-dilutional here means it becomes before the filter, the filter. Okay? Because here you find the red color, that is the arterial pump. So the blood will come here and the fluid also will come here before it reaches the pump. Okay? While post is in the blue color. The blue color means the venous color. The venous color, here is the start of the venous color. This is the end of the filter. So that's why it's post-dilutional. It's after the filter. Okay? This one also to be kept open. We remove the covers. Start everything you don't need. And here time to use that needle for the priming. Okay? Now I make sure that everything is properly connected following the lines. Everything is in place. Very important also to close all these valves unless you need it later. Everything else, close it so there will be no leakage or improper measurements of the pressure. Again, I'm confirming that everything is closed. Now I will open the needle. This needle is a connector between the arterial line and the priming bottles, that is normal saline. Okay, now even this one is ready. Arterial and venous lines are open. Right, Mr. This is the instructions for the preparation. This is simply what I mentioned during this video. So check again, revise everything regarding the heparin. This session has heparin order. And this is where heparin is connected. This wire here is where you connect the heparin. This is the heparin syringe. $5,000 international unit in 50 cc. This is the default concentration even for heparin infusion, and here is where you attach this syringe, so the heparin pump will be pumping accordingly. There are two buttons here for the plunger to be up and down. This is the down button, this is the up button. Fix it properly and then close it so it will be like this. Okay, now the heparin is reaching the end here. Okay, now I put even the heparin syringe. Okay, continue. If you don't know or you don't remember, read the instructions. Setup complete. Okay, confirm. Here is start priming. The machine is asking you now want to start priming. Okay, to confirm. The blood flow is 100. This is the default for the priming. So okay. Before this, I will unclamp the 4 clamps at the back at the same time, to maintain balance. So start the priming. Okay, now you see the saline. We are simply evacuating air from the set, so we will not let air to come inside. Open an injection to fill, clamp connecting connectors. We already did this during the preparation. Now my eye is on that chamber. Okay, when the normal saline started to reach this chamber, I will unclamp here to let the blood come about 3/4 or 2/3 of that chamber. Now I'm declamping with continuous observation and cautions. This is not to let air come from any part. Keep observing all the connected parts. Make sure that there is no leakage here. And keep your eye also on the normal saline bottle, because you might be looking anywhere and you will find this one empty. Air will be coming you will need to start to do the priming from the beginning again. Now these two balloons are full of the substitute and dialysate. If you can come closer, here it's full, as you can see. This one down also, same. This means liquids are coming inside the set. I prefer to increase the blood flow, so I will not wait much time for the priming phase. All this priming solution will come in this bag later. Now I have the screen to enter the parameters. These are the parameters screen. This is the substitute, this is the dialysate, this is the blood flow, this is the ultrafiltration, how many ml per hour, this is the heparin administration, this is the temperature of the blood in the side if you want to control. These are all the parameters that doctor is writing in the order. This is the one I told you to check. Now my eye is here because this one is near empty. So I will be ready clamping before air comes down. I can press stop or clamp. Better to press stop, but if you are not trained on this, clamp. Connect to the other bottle and then remove the clamp, start again. You see the saline is reaching this bag. Again priming. Treatment parameters entered. No, to start your friends, enter the treatment parameters completely. So I will write the treatment parameters. So now we will enter the parameters. The blood flow pump is 100. It's already 100. Ultrafiltration is 100 ml per hour. So I will adjust it to 100 and then I will press. Substitute and dialysate both 800. And now regarding the heparin, it's 250 units for the continuous heparin administration. You will not find it here by units, you will find it here by ml. So 250 international units for our dilutional. When calculated, it will become 2.5 ml per hour. I will also choose this. Now parameters are entered. We'll continue the priming and confirm that all parameters are entered. These up and down arrows for the level of the liquid here. You can do it manually or you can increase the level up or decrease it down, but it will be decreased down while priming using these two arrows. Okay, so start All treatment parameters entered. Okay. Start your efferents. Okay, to confirm. It's telling to connect the venous here to the rinse solution. Already it's there. Sufficient rinse solution. We have sufficient. It will need 300 ml. It's written here. Okay. Connections tight. Yes. If you will give the heparin bolus, it will be here. Now you have a message to turn the ultraflux filter. This is the ultraflux filter. This is for rinsing ultraflux. So make it upside down only during the rinse, huh? And then start. We'll keep priming. Watch that level. Now it's a little bit decreased. You can keep it, or I prefer to make it a little bit up. So I make sure that there will be no air coming at any time. While priming is completed, you will find here 3 indicators, one for the TMP, one for the pressure of the vein, the venous pressure, another one for the arterial pressure. This is the arterial pressure. Now it's around 20. The venous pressure is around 40. The TMB is around 60 or 70. Mainly the arterial pressure is at the negative side, but this is only during the priming. Watch the normal saline bottle. We still need 150 ml. Be ready to clamp. Don't let air enter. Clamping. Declamping. Start again. Discard directly after you finish. Now you will notice the liquid starts reaching the waste, the filtered bag. Down here there is water. The rinse solution will come up here in this bag. Remaining 70 ml until rinse is completed. ml remaining. Now you have a message to connect the patient. Now the machine is ready for the patient to be connected. Unclamp first. Remove this normal saline, because if you disconnect it, this normal saline will be simply dropped on the floor. Okay, we will try not to let the patient be inside of the video. both lumens are tested before for patency and aspiration. So I am connecting the arterial, open the clamp, the patient is connected, read the instructions, continue circulation, press start, connect only the arterial simultaneously. The patient, clamps open, all connections tight, all conditions fulfilled. Now you will notice the blood coming in the arterial line. This is for the priming. Keep observing all connections, anything you might have missed. Don't worry, the machine will tell you if there is anything wrong. It will not go to the next step until you properly done the previous step. The blood will keep going in the circle until this optical detector here, down there, the one I told you at the beginning of the video, will detect that blood. When there is a pure blood coming here, the machine will tell you that the optical detector is detecting blood. Now it's time to connect the venous. If not done yet, connect the venous bloodline to the patient. Clamps open. Connect in pre-dilutional if necessary. We need it post-dilutional, as I told you. Turn back filter. You remember that we turned the filter upside down. Now it's telling you to turn back. So now again, it's same like before. Okay. Close all clamps. Connect the red or the venous tube. Open everything. And then start. Start the treatment. You want to confirm that you want to start treatment? Yes. Here you will find 00 treatment time. This is the total time. So